The theme here that we take through trauma-informed care approach is not focus on what's wrong with you, but understand what happened to you. And this is very well demonstrated by what you see on the screen. We looked at different diagnoses from borderline personality disorder, post-traumatic stress disorder, complex PTSD, and healthy individuals, and looked at their depression levels. There's huge variations across the spectrum. Now, how do you interpret this? The question lies in understanding what happened to you. So different exposure to childhood trauma and different types of trauma exposure needs to be understood. So this is one important message. When we look at depression, understand what happened to these individuals, because depression is an expected outcome of certain situations that they may have experienced, events that they may have gone through, and not as much about serotonin or genes. So therefore, if I summarize, the depression is not a label, it's a map. The diagnosis hints at the possible history that needs to be probed. Solution, my favorite. And here I'm sharing our data, unpublished data, high level, for you to understand. And several important points stand out. Let me summarize those when we talk of solutions. In one line, we don't treat depression. We just uncover it layer by layer till the root cause begins to appear. Several things stand out in our work. First, we need to understand the core events and the emotional pain associated with those events. This is uncovered through the method of index trauma that I keep talking about it. So the role of several childhood trauma categories, emotional pain associated with it, and identifying specific index trauma event is absolutely critical. When that happens, the techniques of inner child therapy and reconsolidation of traumatic memory play a very important role while we address the emotional pain associated with it. When this is completed, the imprint of the trauma decreases. However, this is when a lot of other important work begins. So in my discussion with clients, I talk about this being reset to zero. No negativity, but we are reset to zero. Now you start the journey towards possibilities in life. Here, the work on self-esteem is the most important component, and associated with that is another important component that I've talked many times on toxic shame. Such emotional behavioral aspects need to be identified and addressed. And when all of this happens, the recovery, as you can see now on the screen, higher trauma exposure takes longer time to recover compared to low trauma exposure group. Again, very evident on the screen. Eventually, all of them recover. The complexity of high exposure of trauma is high, and therefore they take more time, but the recovery is there in their case. But they come to an acceptable level of depression much later compared to groups which are having lower exposure to trauma. But in a nutshell, we don't treat depression. We uncover the history, uncover the challenges layer by layer till the root cause begins to appear. And once that root cause is addressed and the new behavioral patterns and thought patterns addressing the self-esteem issues as well as toxic shame are done, the recovery is so good that the person goes back to healthy and happy life.